spotlighted during the event, and you can toggle closed captioning by clicking on the CC button located at the bottom of your screen. All right, back to you, Elise.
Thank you so much, Max. Now I have the great honor of introducing our panelists for today, President and Superintendent, Dr. Viar, Vice President of Instructional Services, Dr. Ritterbrown, Vice President of Student Services, Dr. Schlossman, and the Dean of Student Affairs, Dr. Oukayan. I will turn it over to them for their introductions, starting with Dr. Viar.
I want to welcome all of you and thank you for your interest in the college and what it has to offer and how we're going to be able to serve you through the remainder of our COVID crisis. We thank you all very much, and appreciation to student government for its role in taking leadership to keep you well informed and aware of what's going on and helping us make decisions that are in your best interest. It's good to be with you all today. Thank you.
Thank you, Dr. Viar. On to Dr. Ritterbrown.
Good afternoon, and thanks to ASGCC for organizing this event. And thanks to all of you for taking time out of your day to come and hear about our plans for reopening.
Dr. Schlossman.
Hi, everybody. I'm Paul Schlossman, the Vice President of Student Services. I want to echo my colleagues' thanks to you for being here. It's fantastic to see the number of participants. We have a great crowd. But I'd also like to thank all of you and students, of course, but we also have some faculty and staff in attendance today too, just for your perseverance, your resilience over or during the whole COVID pandemic period. It's really been just inspiring how you're sticking with it and you know keeping your work going towards your goals. So thank you for that. And lastly, I love the video, and it makes me realize how much I miss having people on campus and seeing students in this space. So hopefully we'll get there soon. So thank you.
Thank you, Dr. Schlossman, and finally, Dr. Oukayan.
Thank you so much, Elise and Max. Just welcome everybody. I am very excited to be here today with our panelists and our students. I want to acknowledge the work of the ASGCC and our student leaders throughout this very challenging year and what they've done to advocate for the students, all the events and activities that they continue to put on in the virtual environment to keep you all engaged and connected as much as possible. And so excited to be here and I'm proud to be serving you as Dean.
Thank you, everybody, for your introductions. So to our audience, please note that all of the questions that we will be asking today were submitted in advance. But if you have any questions during the panel, please direct them to Dr. Oukayan, who is named questions on Zoom. So for our first question, what is the percentage of students that need to be vaccinated in order for GCC to be considered safe?
Thanks, Elise. This is a difficult question in that it asks us to quantify risk. And I think that at the state and national level, there are a lot of discussions about what percentage of individuals need to be vaccinated before we are safe. And I think what we need to recognize is that there will always be an element of risk, but that the more individuals who become vaccinated, who do that, the less that risk is. And that's what we're counting on at GCC. We're asking our community to take responsibility, to get out, be vaccinated. We do have a vaccination site on the campus, but there are many vaccination sites throughout the city. And we are strongly recommending that all individuals be vaccinated before, not just before returning to GCC, but in the service of the community at large.
Thank you, Dr. Ritterbrown. For the second question, I'd like to ask, what are the stages or levels of safety in order to make a complete return to campus?
Well, the threat levels are defined pretty clearly by the state and the county. The county defines green as the threat level that would not require any restrictions on movement or gathering. And so that would be where we would look to the county. And in all of our planning, we look to the county and the state and the federal government for the guidelines that they provide. So that as far as the county is concerned, it would be green. And if we reach that stage, there are no restrictions in terms of our access to campus or classes. The state level goes to yellow, which is minimal. And I believe that many counties at this point are in the yellow, but that still implies some risk. So there would be some restrictions still in place with regard to any sort of return to in-person services and classes. Does that answer your question, Max?
I think that does. Thank you.
Thank you. So for our next question, student athletes are currently required to get tested for COVID before attending in-person practices. Will students be required to get tested for COVID before attending classes? And will GCC provide that testing?
Thanks, Elise. I'm going to ask Dr. Schlossman to answer this question.
Great, thank you, Dr. Ritterbrown. Thanks, Elise. Great question. In regard to our student athletes, so our intercollegiate athletics program is the only program on campus that has implemented mandatory testing for students and for our student athletes. This is a requirement in order to comply with the California Community College Athletic Association regulations that govern all community college athletics in the state, as well as our return to campus plans, not just for practice, but also any institution who will eventually engage in competition as well. So in addition to the 3C2A requirements, our athletic program is also paying attention to county protocols on the reopening of sports, recreational youth sports, and the like. While these don't specifically apply to intercollegiate athletics, they help inform our approaches as well beyond the state requirements, the 3C2A requirements. In regard to mandatory testing, currently, the college does not have plans to implement mandatory testing for students or all members of the college community at this point. However, our health center, under the leadership of Tony Reyes, has been approved to participate in a COVID testing program offered through the California Community College Chancellor's Office, the California Department of Public Health, and Valencia Labs. Now, this particular program would involve self-administered tests for those who are getting tested under the supervision of our health center staff, and it would be free to the college and all of our students. Now, Tony Reyes and her team are prepared to administer the program similar to how we do the regular flu vaccine clinics. But to that end, we'll need to get the necessary approvals from the college and address any union concerns first. But we have plenty of time to finalize and explore this before a broader return to campus happens. And then just in relation to testing for members of the college community, COVID testing is considered a health exam. So all HIPAA protocols governing medical exams we would need to follow. And this would mean we'd have to ensure the privacy related to medical exams and medical records, practices that our health center follows as a matter of course anyway. So that should answer each segment of this question.
Thank you. And so just to clarify, at this moment in time, GCC will not be providing COVID testing for students.
Right, not mandatory COVID testing. We are geared up to do voluntary testing if we have all of the approvals to do that through the health center. And then additionally, I
believe he cut out.
Okay, was that just me or was that everybody?
That was just you, Dr. Schlossman.
Oh my gosh, and I'm on campus and I'm hardwired into Zoom. Okay, and what I was saying was just the last piece is that the Chancellor's Office has given guidance to all of the colleges in the state as far as testing, making that mandatory. So we are following that guidance very closely.
Thank you very much.
For the next question, I'd like to ask, will vaccines or booster shots be required for students to attend in-person learning?
Thanks, Max. There are two answers to this question. One is with regard to masks and other personal protective equipment. The answer is yes. We are continuing to monitor the FDA and state and county guidelines with regard to personal protective equipment, especially masks. At this point, we anticipate that masks will be required for in-person services and learning, and masks must be worn at all times when individuals are on campus. With regard to vaccines, campus has no plans to require vaccines of students or staff. There has been a lot of discussion statewide about the fact that the UCs and the CSUs have announced plans to require vaccines. It's important to note that they've also, that requirement will not go into effect until the FDA has fully approved the vaccines. So at this point, vaccines could not be mandated on any campus until that FDA approval comes through. We do know that once approval comes through, campuses do have the authority to require vaccines, but we have to consider all of the elements that go into that and the complexity of implementation that would be involved, including, as Dr. Schlossman noted, the keeping of records. And the UCs and the CSUs have a very sophisticated healthcare system for students, which enables them to keep that kind of record at this point. That it would be more difficult for campuses such as ours to enforce that. And enforcement is also a question in terms of how that would be enforced. Would students be required to produce proof of vaccine before they could register? Does this mean that they would have to appear in person to do so? So I think there's a lot of complexities, but the short answer to this is no. Glendale College does not have any plans to mandate vaccines for students or staff.
And I do want to clarify, do you think that students should expect to have mandatory vaccinations once it is FDA certified?
No, we do not have any expectation at this point of mandating vaccines for students or staff.
Okay, thank you.
Thank you very much. So you actually answered our second question about instructors being required to get vaccinated. So we'll move on. Will students be able to choose if we take online or remote or in-person classes once the campus does reopen?
Thanks, Elise. Yes, to the extent that students are able to choose classes at this point. The restriction is based on enrollment. If a class fills up, then we would not be able to accommodate a student who wanted to take that class either in person or remote. But the anticipation is that we will continue to offer options for students, including fully online, hybrid, remote synchronous, and in-person instruction. And the anticipation is when we reopen it in spring, that we will have a blend of those classes for students so that students may choose what the option that best suits their needs.
Thank you very much. And a question that just came in the chat was just a clarification, is fall semester still staying remote or will it move back to face-to-face?
Fall semester is primarily remote. We continue to monitor the directives from the state and federal government, and we have reopened some hard to convert programs. We have given them permission to begin to offer some in-person learning experiences. We're being very cautious about this as restrictions have not been fully lifted at this point, but we do anticipate that certain performance classes, certain lab experiences will, and kinesiology will be allowed to return to campus in some capacity. We're still determining what that capacity will be, but as we receive more information from and directives from the federal government, the state government, we will continue to monitor that and see what in-person services and classes may be offered. But the answer is yes, primarily in fall, primarily classes will be remote.
Thank you for that response, Dr. Ritterbrown. For the next question, I'd like to ask, how many people will be in physical classrooms at one time? What is the school's student capacity?
The number of people who can be in a given room at any given point is a moving target. We continue to receive updates from the state and the county as to the number of individuals that can occupy classrooms. There are specific guidelines for higher education. The guidelines at this point are that room occupancy can be up to 50%. So we know that an average 40-seat room, that would be 20 students, as long as those students can be separated by 6 feet between each individual. In terms of building capacity, we're currently doing an analysis of how many rooms in a building could be occupied at any given time and still maintain the safety of the individuals in the building. So determining what safe occupancy looks like. Once we've done that, we know that building occupancy will largely determine campus occupancy. In other words, that critical mass that we can say with some assurance that we can maintain the safety of everyone who's on the campus. So it's a fairly complicated equation, but it will be based on the number of individuals who can safely occupy a building at any given time and the number of buildings that can be safely occupied. And you have to keep in mind that it's not just the classrooms and the offices in the building, but it's the paths of travel to and from. So we need to maintain clear paths of travel for students that don't bear too much traffic at any given time. And we need to know that elevators and doorways and stairwells and such would not become overcrowded at any given point. So a lot of this has to do with staggered scheduling, so that we don't overcrowd any given area of the campus at any given time. Does that make sense? So the number of people on the campus, the critical mass has yet to be determined.
Right. I do want to ask a quick follow-up question. So again, it seems evident that, again, it is a bit of a moving target, and you guys have to, go through the process to analyze what that appropriate number would be. Do you think that once fall semester rolls around, do you think that number will gradually increase as the semester goes on and as COVID restrictions lessen and the vaccine becomes more prevalent?
Well, certainly we're in a positive trend right now, right? We went from 25% occupancy to 50% occupancy. So if that trend continues, sure, we would be able to increase the occupancy of any building or room. But none of us can predict with any absolute certainty that trend will continue. So that we will continue to monitor the directives we get from the county and the state, and we will base our implementation of a return on those guidelines.
But
Thank you so
Michael, can we follow up in terms of, will there be, once the fall semester begins, students have registered, they know what their classes are, in what modality, will there be changes, or can they expect that if I signed up for a remote class, it will continue remote through the fall once we started?
What we've said from the beginning is that students, staff, faculty need to know what to expect, especially students. And if we've committed to a certain modality, we will maintain that commitment to that modality unless unless the situation grows worse. And if we've scheduled in-person classes and we have another significant outbreak and the threat levels change, we can pull back to a remote environment, but we would not move from a remote environment into an in-person environment, as that, I think, creates significant difficulties for some students who have planned for a remote environment. Dr. Viar, does that address your concern?
I think Max is muted. Max.
I'm sorry, I didn't hear if Dr. Viar responded or not. I didn't want to trample on him, but I do have another follow-up question just in regards to this topic. And that is, as we think about a safe return to campus, how is GCC going to improve ventilation challenges in the classrooms and offices?
Oh, wow, I'm great. It's really great to have just a concrete answer for this. Yes, GCC is upgrading all HVAC systems to be consistent with the recommendations for safety and with regard to the spread of any contagions. So every room on every campus will be upgraded, and the project is already underway, and we expect that it will be completed by the end of August. And I wish I could explain all the ins and outs of this particular system, but it's quite sophisticated. And if you're really interested, I can get an answer from our facilities director, but it is an impressive system.
All right, well, most excellent. Thank you, Dr. Ritterbrown.
Thank you. So over the course of the past year, many students have expressed their frustrations with online learning because they don't have quiet spaces to study. Will study spaces be available for students in the fall? I know that this is hypothetical because we've been talking about classrooms, but with regards to study spaces outside of the classroom, is that a possibility?
Yes, we are in discussions to open up study spaces, and we're looking at some of the larger spaces on campus, such as the Learning Commons and the library. We're still we're still in the process of determining what protocols would be necessary to put in place in order for those spaces to be safe and for cleaning and sanitization to take place on a regular basis so that we can ensure that safety. We're also looking at the possibility, we are implementing the placement of Wi-Fi in parking areas so that students can sit in their cars and still have the campus Wi-Fi. So we're looking at all of the options where this is concerned. I do know that this is a concern for students, and we're going to do our best to answer it. But as always, our first concern is that we create an environment in which the students are safe.
Thank you. For the next question, I'd like to ask, many students sadly feel like they have to catch up with their peers academically upon a return to in-person learning. Do you believe that in-person tutoring will be available for students?
Again, we're in discussions to determine whether we can offer in-person tutoring services. This is obviously an important service. If we are able to, we will do so. In any case, we will continue to offer NetTutor or Smart Thinking so that students can get online help, and we will continue to offer Zoom services for students in terms of tutoring. But we're all hopeful that we may be able to offer some in-person tutoring.
Thank you very much. So the next question is, if science labs resume in person, will students be forced to come back to campus, or will there be an allowance to continue working online?
Well, we've always had online classes, fully online asynchronous classes. And we will certainly continue to offer those and continue to expand those offerings. But we've also realized that remote synchronous instruction is better for a certain population of students, that this is something that they like and something that suits their needs better than in-person instruction. And this was a significant discovery in terms of that we were forced into this situation initially, and now that we've discovered that it works very well under certain circumstances. So my anticipation is that we will continue to offer in-person classes, hybrid classes, fully online classes, and asynchronous classes. And we will monitor the demand in terms of what students prefer in terms of those modalities.
Thank you very much. So may I ask where this data came from about students enjoying this online environment?
There were two different surveys that were taken, one early on in the shutdown and one last fall. And in both cases, about 70% of students indicated that the remote synchronous environment was acceptable. Some liked it a lot. I think that was about 20%. Some said it was fine. I think that went up to 50%. And I think there was another 20%, and don't quote me on these percentages because they're coming out of my head, but another 20% said it didn't matter to them. And then there were a minority of students said that they had difficulties in this environment.
So can I ask then what percentage of the entire GCC student population answered this survey?
That data I do not have. I can get it for you, but we were surprised. I remember saying that we got a fairly significant response. And at least I will ask Dr. Cart to provide me that information, and I'll send it to you.
Thank you very much.
So the college is implementing a loss of priority registration for students with outstanding debt. We want to share that it has been very challenging to get support from the tuition office. Can the college consider opening some office in person if the remote environment is not working?
I'm going to ask Dr. Schlossman to answer this question.
Okay, while I do not oversee the tuition office, I can let you know what we're planning in student services generally, and I'll address the tuition office specifically too. So in our student services offices, so admissions and records, financial aid, counseling, et cetera. There are a lot under student services. We will be opening up in-person services. In fact, we'll take a hybrid approach. We will have in-person services and we'll maintain our remote services as well. Because what the feedback that we've gotten is for students not to have to drive to campus or hop on a bus or get a ride just to take care of some basic student business when they can do that remotely, submit documents electronically, all of those modalities. It's of great benefit, and it actually has helped us expand our access for students and make it more convenient. So we're going to do both. But of course, with tight safety protocols in place, both for our faculty, staff, and of course students, as has been discussed. So that's our approach. If every student services unit and office has developed their plans for reopening. And then our managers will be getting together to collectively make sure that our plans are consistent. They're well integrated, both with service approaches and hours of operation, particularly hours of in-person operation. So certainly our accessibility will be broadened for students in person and remotely. Regard to the tuition office and the payment of fees, like I mentioned, that isn't under student services, that is under our Vice President of Administrative Services, Dr. Culpepper. But we have discussed, and I will pass on some of the suggestions that I have received from students in relation to, well, if you're doing remote Zoom services and have messaging services, email services, phone answering services, those types of things, can you advise the tuition office staff? And yes, I will pass on what we have learned in student services to help whatever office, other office on campus implement as well, based on the feedback that we've gotten. And I'll say in student services, we are looking for perfection. We haven't gotten there, but as we learn more and we try to improve and bring in new innovations to help serve our students better and preserve access and increase access in this environment, we are always looking to improve and innovate.
Thank you, Dr. Schlossman. And I have a follow-up question, actually. So what do students do when they're having a hard time getting in touch with departments? I know that, COVID has presented a very difficult environment, but some services have been very challenging.
Mm-hmm. Mm-hmm. Well, what I would recommend is every one of our offices has a webpage. And let me speak to student services offices specifically. So there is a main student services page. So if you get on the college's website, just in the search bar, put in student services, it'll direct you to a main landing page. And every one of our services is represented, and there's a link to the service on those pages. So has contact information for each individual office. and that would include contact information for the administrator or manager who's directly responsible for the day-to-day operations of that office. And I would encourage students to contact our program managers directly on that. And then also students can feel free to contact me if they're encountering problems as well. What we want is for our individual program managers and staffs to be able to handle those issues directly and in an expedient way. So it's always best to directly contact those folks in the offices, those managers, to handle these problems. But if those concerns come to me, I contact our managers, and then we figure out what needs to be done, how we'll respond to the student, whether that response comes from me and me calling or emailing a student, or if our individual manager in that area will do that too. So that is my recommendation. And, look, it's part of our service. It's part of our duty to be responsive. So if we're not, I know that I can speak for all of our, for Dr. Viar, Dr. Ritterbrown, Dr. Oukayan. We want to know about it.
Again, just to clarify, so what you're saying is that students, if they are having problems with any services, they should get in contact with managers specifically?
Yes, that would be the quickest thing to do as far as the response, because those managers are directly responsible for those day-to-day operations of that particular department, and they supervise the staff and have that regular contact with those, with the departments and the staff and the daily operations. Certainly, if there are larger concerns, or if people don't know who to contact in a particular department, a lot of times concerns come to me as the Vice President of Student Services. I know they come to Dr. Ritterbrown. Dr. Viar gets some of these concerns and complaints, and we'll address them. So in some way, shape, or form, either the manager or administrator directly responsible for the operation, or you can contact us as the senior executive administration.
And just to make sure, the manager's information is it displayed on those like the web pages for the services?
Yes.
Okay.
All of the contact information, it should be, and that reminds me, well, I better go on our student services web pages and make sure that they're up to date and have all that contact information. But you should be able to find staff contacts for each of the areas.
And
Max, I would add that in the instructional areas, we have division chairs for each instructional division. They should be contacted if the instructors are unresponsive. And then any of the instructional deans, and as Dr. Schlossman said, you're welcome to contact me, and I will help facilitate any kind of communication.
Okay. Thank you.
Thank you very much. So for our next question, if students have the option to choose whether they want to do remote or face-to-face classes, will international students have that same option? In a normal situation, the international students said that they only are allowed to have 3 units of online classes. So what types of policies will be built around international students?
Thanks. I'm going to defer to Dr. Schlossman on this as well.
Yeah, the policies as far as international student education and participation in our programs and eligibility to do that, those are really set by the federal government, and in relation to immigration laws directly affecting F1 visa or international students. So we would follow all of those requirements as an institution that participates in international education. Right now, I mean, it's very challenging for international students because of immigration restrictions, particularly related to COVID, and the difficulty associated with being able to travel to the United States. I know a lot of our international students are maybe in their home countries and they're taking courses remotely. They're not here physically in person, which I hope is working out well. But as far as those students who are here, international students who are here and didn't leave and go back to their home countries and are taking our remote classes, and then hopefully we'll be able to transition into the in-person classes as we slowly start to roll those out. What you will do is it's really important to stay in touch with our international student staff, our international students counselors, who can give you the latest developments, the latest rules, the latest guidance that we're receiving from the federal government in order to maintain eligibility as an international student. There have been some of the regulations that have been relaxed in recognition of the difficulties with the pandemic. But like a lot of things, those things regulations are a little in flux, or they're being adjusted according to the current situation. So our faculty and staff in the international students program are keeping abreast of all of those changes. So that's the best way to get the latest and most up-to-date news on that. And our international staff, they're all available by via Zoom for remote, if you could call it in-person remote service and advising, and then of course the usual ways, phone calls and emails as well.
Thank you very
I
much.
have a question. So what are you saying is that every student?
Sorry, Angela, can you please type your question in the chat? I believe, just to follow up then, I believe Angela was specifically asking about the 3 units of online classes. Is that going to stay the same, or is that going to change?
I'm sorry, can you repeat the question?
So the last half of that question was, in a normal situation, international students are only allowed to have 3 units of online classes. Is that going to change?
Yeah, as far as the regulations in a normal situation, if we were to turn back the clock or move forward and we're completely in person and operational, I don't know if that's going to change. My sense is that those requirements that were in place under the non-pandemic circumstances, we would more than likely circle back to those. So like I said, there were many exceptions to educational policy and immigration policy that were made during this period, both for international students and resident students. That remains to be seen. But with those changes, whether they, regardless of the change, that's why I'm suggesting with our international students to make sure that you're maintaining contact, making appointments with our counselors who will have that information. I can't, it's hard to give a blanket answer or predict if those things will remain in place. Time will tell according to the situation. Yeah.
Paul, this is David Nelson real quick from International.
Oh, good, David. Just so you know, David Nelson is the Director or Program Manager for our International Students Program. Didn't know you were on, David. I would have.
No, you did it. Can I just say real quick?
David, we have a few more questions to get.
Okay, all right, that's all right.
Time. So if there are any international students in the room, just please email. I believe David put the email in the chat earlier, so just.
Yeah, I did. Thank you.
Thank you very much. So we will move on then. Go ahead, Max.
I got you. All right, so our next question is, so mask policies in LA County keep changing with, the lessening of restrictions. Will masks be required on campus? Additionally, what will the consequences be for people who violate mask and social distancing rules? And finally, who will enforce these rules?
Good question, Max. The first has to do with the fact that the directives with regard to mask wearing continue to change as the situation changes, and we will continue to monitor and respond to all county and state directives as well as federal directives. So we can't say for sure what will happen, but I can say for sure that we have and will continue to respond to those mandates. Second part of your question had to do with enforcement, I believe. If a student or staff member or visitor to the campus declines to wear a mask. And the first answer to that and the last answer to that is that the best way to ensure a safe environment is to provide clear and consistent information to all members of the campus and the community with regard to the directives, expectations, and mandates that we have on our campus. And it is true that if individuals understand what's expected of them, then we have a much better chance that they will respond in a way that we expect them to. If this is not the case, in the case of a student, we do have student disciplinary procedures in place that we would implement in the case of a student who refused to wear a mask, and we would follow the due process that is required in those circumstances. And as a last resort, campus police have indicated that they can provide limited support in these cases, but that support would necessarily be limited. Does that answer your question, Max? Did I get all three?
I believe so. So again, I just kind of want to clarify. So when it comes to enforcement, mostly like, there will be limited support from campus police. So probably be monitoring the situation. And then when it comes to, consequences for people who violate masks, could you just restate that one real quick?
Well, give some background.
Yeah, go ahead, Paul. Thank you.
Yeah, I'd be happy to. Look, as Dr. Ritterbrown mentioned, look, before we even, what we want to do before we even have to think about consequences or enforcement is really to have education, clear messaging to students, all members of the college community, about what our expectations and requirements are. Now, all college employees have to follow COVID protocols while they're here on campus, which currently include, among other things, mask wearing, face coverings being a requirement. And right now, if we were to, have a return to campus, or actually our students who are returning to campus right now, for example, student athletes, everybody has to wear a mask. If we had a broader return, that would be part of our student protocols as well. And as Dr. Ritterbrown has said, those things they may change by the time we are ready to have a wider return. So first of all, we are actually developing and finalizing protocols for students, much like we have established protocols for staff to be here in person. But in addition to that, we're working on procedures to ensure that if a student does come to campus while they're sick or get sick while they are on campus, that we would have procedures in place that will help them return home as soon as possible. That would include, it keeps ill students separated from others until they can leave, because it may be some time before their ride comes, or for example, because they might not be able to leave immediately. So we'll have those procedures in place. Overall, though, as part of the education and part of the awareness and the messaging is, look, the college has a responsibility for not setting a tone that discourages students from staying home when they're legitimately ill. Obviously students with respiratory illnesses should stay home to avoid transmission to others. But even if not every illness is COVID-19, and even with other respiratory illnesses as well. But we meaning the college, we need to clearly inform students that we don't expect those who are sick to attend classes. And then part of that too is making sure that our instructors and our instructional divisions understand this too and communicate that. And perhaps, well, not perhaps, we'll need flexibility from instructors in terms of attendance, grading, deadlines, making up work, that type of thing. Because we don't want to give the message to students who are sick that they have to be here, that they need to attend classes at all costs. No, that puts themselves and others at risk. But as Dr. Ritterbrown said, we do have policies and procedures in place related to student conduct and enforcement and consequences, as was stated in the original question. We would do that through enforcing any COVID-specific policies and regulations that actually were just discussed in our Administrative Affairs Committee, which has student representatives, but as well as our standards of student conduct, which have regulations and policies to ensure the health and safety of the college community. So the responsibility for enforcement, if you will. Well, look, our faculty would remind students in classrooms. Our staff in various offices would remind students if enforcement and consequences are necessary. We have an established student conduct process, which Dr. Oukayan administers as a Dean of Student Affairs, and then, of course, college police if a situation warrants their intervention.
Thank you so much, Dr. Schlossman.
Thank you. So our next question, we only have 5 minutes left, unfortunately, and we have 2 questions left. So for the first question, local community colleges are moving towards opening this fall semester. So even if it's at a limited capacity, is this a concern for GCC's enrollment to be competing with these other colleges?
Well, Elise, from the beginning, our first concern, our first priority has been the safety of our students, our faculty, our staff, and our community. So when discussions of competitive enrollment arise, I would say that is not our concern. And we certainly hope to accommodate all students that want to come to GCC and to provide as much access as is possible under any circumstances. But I don't think that we can prioritize competition over the safety of our community. So the answer is, and the second part of that is, as I said before, we are responding to continuing availability for in-person instruction. We have opened up a number of hard to convert areas, and we are working to bring in-person instruction to those areas, and we will continue to do so. But the bottom line is that no, we are not going to prioritize competition with other colleges over safety.
Thank you very much.
Thank you. And for our last question for today, I'd like to ask, because of COVID, we have lost many student worker jobs. When will we start allowing student workers to work in person if they are hired for work studies?
Dr. Schlossman, do you want to take this one?
Sure. So, and I know our career services manager is in on this Zoom as well, but so generally, look, student worker, student assistant positions are really important. We recognize that, both for the experience of working on campus, but of course, having a job and getting the payment for the job. So student worker positions in person will be rolled out according to the need and all of the college protocols that govern the return to campus for college employees as well as students. And it's really going to depend on the operational need in a given area, okay, first. and whether or not, look, the in-person student work is absolutely necessary, but also just like we would regular college employees, how can we best ensure the safety, or if not ensure, mitigate the risk for student workers to be on campus and working and interacting with others. So I would say, yes, we want to return student workers to their on-campus jobs. And we will do so as the need dictates, but also as the overall health and safety circumstances indicate as well. Last thing I will add, that we do have student workers working remotely right now in various departments. For example, in Dr. Oukayan's areas, Student Outreach Services and the Welcome Center, there's some really vital student support being provided there. In the Career Services Office, with live Zoom support, our student workers are very instrumental in that. And then there are certain required areas, and this would be an example of a need that for sure requires in-person service. In the science areas, mainly biology, for example, there are live animals that we have in those areas, and we do need in-person care for those animals, and that's handled by student workers. But the need certainly dictates that in-person work.
Thank you very much. So that was our final question. I understand that we didn't get to everything that was said in the chat. We will be saving the chat and reviewing some questions so that hopefully we can provide some more concrete answers in the future. Obviously, this is not a conversation that is going to end anytime soon. But thank you so much for joining us today. We hope that this information was informative, and we thank everybody in this room for your patience and perseverance over the last year and a half. I will now be turning it over to Dr. Viar for some closing remarks and the major takeaways from this afternoon's events.
You're muted, Dr. Viar.
You're muted.
Thank you, Elise and Max, for facilitating the meeting today, and for ASGCC and organizing and giving the students an opportunity to ask questions. I know from reviewing the chat, I hear from the questions, people want certainty, and I understand that, but it is a challenge because every day there is a little change in what we are receiving from state and federal and local county officials as to what we can do and what we can expect to do. As I referenced a couple of weeks ago in a communication to the students, this is not about a light switch being turned on or off. It is about the dimmer switch and gradually adjusting and making a difference as it reflects what is needed at that particular time. There have been comments about why is GCC the only one who is remote. We did not say we are only going to be remote. What was stated was there are programs and courses that will be offered on campus. And I think if you look closely at what other colleges are saying, while they may say we're back, you look closely and they are facing the same situation we are in LA County. Right now, 50% of classroom capacity. And if we were to do that, that would mean that 50% of the students would not be able to be served in that classroom environment. So there is so much we're looking at as we try to address first and foremost, as Dr. Ritterbrown said, the safety of our students, employees, and the communities which you return to, and then student access and success, and making sure that that is what we're all about while facing our own fiscal realities. So I appreciate all that you are doing and how hard you are working to get as much education as you can. I know that we are all challenged with our mental health and stability. And so I urge all of you students to take advantage of our mental health center at GCC, touch base with them, find out what the resources are available so you can help yourself be the best that you can be throughout all of this. We are looking forward to a day when we will all be back together, but we will continue to do all we can to give you as much service and support to be successful through this challenging time, and appreciate all that you are doing. Thank you.
Really quickly, I just want to say also thank you guys for coming and speaking today. Thank you, Dr. Ritterbrown. Thank you, Dr. Schlossman, and thank you, Dr. Viar. Really quickly, again, I just want to say thank you to the audience for attending today as well. I know that there were a lot of excellent questions put into the chat, and I hope that today's town hall provided some concrete answers for some of those more important and pressing concerns. Really quickly, I do just want to say, you know, the end of the semester is coming swiftly upon us. So for all of my peers out there, I wish you the best of luck on your finals. Only a couple more weeks, so finish strong, guys. And additionally, for anybody who is going to be attending GCC in the fall or in the summer, try to stay involved in the virtual community. Join a club. Again, as Dr. Viar said, you know, attend the mental health institutions that are present on campus, and just stay involved, right? But again, thank you guys, everybody, for your attendance today.
Thank you so much for coming. This concludes our event.
Thanks to all of you.
Thank you.